Morning, everybody. Welcome to the TEPI meeting this morning. I would like to call the meeting to order. Today is 3/18 at 9 o'clock. And Shelley, could you please do roll call?
Sure. I'll just advise attendees that this public meeting is being recorded and will be posted on the ADHS website. So anything said verbally, anything viewed via webcam, or anything typed in the chat box will become part of the recording that is posted. Please try to mute your microphone when not speaking. If you're attending by phone only, you may need to press *6 to unmute yourself. Shelley and Julia will be monitoring the chat area for comments and questions that the chair needs to be advised of. And then for everyone's benefit, please identify yourself before stating your remarks. And thank you for your patience and your participation. All right, Allison Welch.
Here.
Amber Prince.
Present.
Candace Williams.
Here.
Carrie Lewis.
Here.
Dale Woolridge.
Here.
Deborah Verkick.
Here.
Am I saying your name right?
Yeah, it's perfect. Thank you.
Okay. Garth Gamer.
Present.
Heather Miller. Jacqueline Kurth. James Cecilini. James Cunningham. Joshua Gaither. Absent. Julie Augenstein.
Present.
Laura Smith.
I'm here.
Melissa Moyer.
Here.
Michelle Guadagnola.
Here.
Pam Noland. Paul Dabrowski.
Here.
Ralph Kelly. Ray Proa.
Here.
Rebecca Harrow.
Present.
Sean Boker. Tiffany Streever.
Here.
Tom Flanagan.
Here.
Oh, thank you. 1, 2, 3, 4. I count 16. We have quorum.
Very good. Thank you, Shelley. All right, we'll start out with the chairman's report. Item number 3. Members, please find attached the attendance report. A reminder that per the bylaws, members missing 2 consecutive meetings will be contacted by the Bureau about continuing on the committee. Item number B, we would like to welcome new members to our team. We have 3. Jacqueline Kurth, she is the ADHS Injury Prevention Advisory Council representative. Deborah Verkick, she is the North Region Pre-Hospital EMS Coordinator. And Allison Welch, she will be the Central Pre-Hospital EMS Coordinator. So welcome to those 3. I would also like to thank Pam Gosler, who has served on our TEPI for many years. She has retired. She will be missed very much. I've had the pleasure of working with her for over 30 years. So thank you, Pam, for your service. We do have a vacancy report. There is a vacancy for the Air Ambulance Premier EMS Agency Quality Improvement Officer. For those who would wish to apply for this appointment, please submit a letter of interest or CV or resume to Shelley Bissell. Vacancies are appointed by the Bureau's Medical Director, Dr. Bradley, under the advice of the Chair, the Bureau Chief, and the Bureau Liaison. Number 4, the Bureau report. Chief Garcia, would you like to go ahead with that, please? Regulatory scope of practice update.
Good morning. Yes, can you hear me? How's my audio?
I can hear you.
All right, great. The Bureau of EMS and Trauma System continues with our normal business operations. I just wanted to share briefly on some staffing transitions. We are in the process of filling several vacancies and wanted to let the committees know that we'll begin interviews at the end of the month for the Services Section Chief position, formerly held by Ben Fisher. And the position will continue to be open to candidates online. We've also recently welcomed some new staff to the Bureau, including Compliance and Enforcement Manager Marley McCormick and Trauma Registrar Carissa Wilson coming online. Julia Vinton has recently been promoted to a Health Program Manager position, overseeing several of our grant programs, in addition to the vacant EMS for Children position. If there's any interest out there, if you know of anyone, the state jobs website is currently featuring all Bureau positions that are open and accepting applications. I do have a few updates to share on rulemaking, emergency orders, and waivers. For Articles 9 through 11, the department continues to seek stakeholder feedback on the rulemaking process for ground ambulances. The Article 9 work group will continue to meet on a monthly basis to provide feedback on the ground ambulance draft, and the department will be seeking additional stakeholder input on Articles 10 through 11. For air ambulance rules, Articles 7 through 8, those are being reviewed for final comments. And once there's a formal notice of proposed rulemaking filed, there will be an additional 30-day review period for public comment. The remaining process before adoption for our air ambulance rules is expected to be extended through mid to late 2021. For scope of practice, Article 5, based on the recommendations from the statutory committees in rule to make sure that we are updating scope of practice to be consistent with national standards. The Bureau is working with the Administrative Council and Rules on an exception request for exempt rulemaking to update Table 5.1. We still expect this process to include a 30-day review period for public comment before adoption, and we'll keep the committees updated on progress related to the scope of practice rule updates. We have a few more items that have been shared with EMS and trauma system stakeholders regarding governmental orders and waivers. Executive Order 2020-63 extends the Good Samaritan order to provide healthcare workers and EMS providers acting in good faith with immunity protections through March 31st, 2021. There's also Administrative Order 2020-15, which provides limited EMS rule waivers, including flexibility on CON boundaries through March 31st, 2021. Emergency Measure 2020-05 authorizes all levels of EMCTs to administer COVID and influenza vaccinations, as well as perform diagnostic viral testing with prior written approval from an administrative medical director. We'll let Dr. Bradley and the team share additional updates on training resources and protocols that will be updated on our ADHS website for EMS providers related to COVID-19. I'll share that the Bureau is doing some research and requesting feedback from stakeholders on moving towards a digital certification process starting July 1. We are expecting that all of the governmental orders and waivers that have been shared so far will be revised and extended as appropriate at the end of this month or early April. And with that, I'll end report. Thank you.
Thank you very much. The STABS blood product and work update, Dr. Bradley.
Thank you, Melissa. And I just want to say thank you to Melissa for stepping up as the vice chair to run today's meeting. So Dr. Gaither is on spring break skiing somewhere. So he was going to try to do this from the slopes, and Melissa kindly volunteered to run the meeting. So a big thank you to Melissa for stepping up today. I'll just quickly finish up what Chief Garcia had mentioned. We are looking to update the current EMS COVID guidelines that were approved last March and updated in July of 2020. We do know that we've learned some more in terms of COVID management, and we'll be working over the next month or so to get those updated and distributed along with the training PowerPoints. So that should be coming shortly. In terms of the STAT blood product work group, we've had really good participation. We had one meeting with a follow-up meeting at the end of this month. And really, we've kind of clearly delineated kind of what the scope of that would be, making some recommendations for kind of who can currently recommend and administer blood in the pre-hospital setting. And we'll be bringing that back to TEPI once we have those final results of that work group. So that should be presented to STAB at the next STAB meeting in May, but we will also update TEPI when we meet next. And I can give an update next about the naloxone leave behind program. We wanted to start bringing this up as kind of a topic. If anyone's able to stick around for the PMD meeting later on today, Dr. Glenn from Southern Arizona is going to be giving a presentation on her naloxone leave behind program. But essentially, we wanted to make sure that everyone was aware that in Arizona, this was in the initial rule that was passed, which allows EMS personnel to provide naloxone to bystanders, patients who may be at risk for an opioid overdose. We do have some links. I put in the chat box the link to the ADHS opioid website that's specific to EMS, and it has the standing order for naloxone leave behind, as well as for EMTs that may not have medical direction that wanted to provide naloxone. That would be under a standing order for myself. So those links are on there, and we are just going to try to do some more advertising about the naloxone leave behind program. I think probably people have seen in the news, there's been a lot of coverage about the opioid epidemic and the effect of COVID on that, but we are certainly starting to see higher rates of opioid overdoses, and also many patients who do not want to be transported to the hospital because of some fear of COVID. So we're going to really work on that, hopefully in the next few months, of trying to spread the word about that program. Any questions on either of those two items, either the blood product work group or the naloxone leave behind? All right, thank you.
All right, thank you, Dr. Bradley. Next is Save the Hearts in Arizona Registry and Education Program updates. Julia Benton.
Good morning, everybody. Just a couple of updates for share on the Bureau side. We are currently working on updating our webpage and documents related to cardiac centers, heart safe recognition, resources, etc. Additionally, in the near future, we hope to do some updating of our information that we have for cardiac receiving and referral centers. So we hope to be reaching out to hospitals to collect that information in the near future. I can also go ahead and do the EMS for Children updates. We are in the midst of the EMS survey. It actually closes tomorrow, so thank you to everybody that's participated. We have received 73 respondents. We also will be participating in the National Pediatric Readiness Assessment starting on May 1st, so that will be a similar assessment of hospital pediatric readiness, and materials for that will be sent out soon. For PACES, we had a children with special health care needs work group, and so we developed a tracheostomy management training for EMS, which will be presented today at the Education Committee as well as at PACES. And then I also wanted to update the group that there is an adverse childhood experiences training that was developed as part of a separate grant, finalized and currently on our website. That's all I have. Thanks.
Thank you very much, Julia. Data dashboard updates, Vatzel.
Yes, good morning, everyone. Sherry, will you be opening up the data visualization page?
I stopped sharing so that you could share your screen.
Oh, you want me to share?
Do you want me to just click on that link?
Yes, please.
Okay.
Yeah.
Just a moment.
I'm just going to give you a quick overview of our data visualization page. We have created a separate tab for all our dashboards. Currently, we have four dashboards under the data visualization page. One is trauma overall, which is very similar to our annual report. And then there is one is EMS overall. Again, it kind of reflects the EMS annual report. And then what we did is we dig into the two major traumatic injuries, motor vehicle traffic accidents and falls, and so created a separate dashboards on those. And then there is a fifth one also, not fourth, sorry, the fifth one which is a race dashboard, and which talks about you can basically select any ethnicity and see the distribution of trauma in that ethnicity, and some even see the comparison. Our plan for this year is to develop more dashboards, on a small projects, picking out some of the injuries, or on the EMS side, talk about some of the performance measures and create the dashboards on those. So you will be seeing more updates on this page, later, I think another quarter, and we are planning to add a couple of more dashboards. That's about it.
Thank you, Vatsal. That's actually very beautiful. Right, next, Premier.
Melissa, sorry if I can just speak up quickly.
Yes.
So just to, with all the work that Vatsal and her team has done, just wanted to mention they have been closely tracking the opioid-related incidents in Arizona with COVID, along with out-of-hospital cardiac arrest numbers. And so we're definitely seeing much higher out-of-cardiac arrest numbers across Arizona in 2020 over 2019. That trend has extended into January of this year and a little bit into February, although that rate does seem to be normalizing. So we are going to continue to monitor those numbers. And Vatsal and her team are also starting to look at some reports looking at refusal rates and non-transports and potentially how COVID has affected that compared to previous years. So we anticipate being able to provide that information at the next round of meetings for TEPI. But definitely something that we know impacts the overall public health in Arizona, especially when you look at things like stroke and cardiac arrest and chest pain. So we are closely monitoring the data, and Vatsal and her team are working on building more reports for that. Thank you.
Very good. Thank you, Dr. Bradley. Thank you, Vatsal, again.
Thank you.
Premier EMS Agency Program Status Guide using validation scores, and Vosbrink.
Hello, everybody. I'm going to present and let me know if you cannot see my presentation in a moment. Okay, can everyone see the screen?
Yes, I can.
Okay,
yes,
great. So I'm just here to update.
Can you make it, I'm sorry, Anne, can you make it a little bit larger, please?
It's at my full screen. Let me see if I can.
If you go to just go to slideshow format, it'll make it the whole slide. That should make it larger. Just from the beginning at the far left.
Yeah, that's what I did.
Oh,
sorry.
That's odd. Okay, I've not seen that. Sorry.
I'll just try. I don't know why, because it's big on my screen, but I realize it's not big on you guys'. So I will. Let's see. I'll try 100% and see what happens. That's all right. A year in, and we're still learning. Is that better? I can do it even bigger. I think that worked. Here, we will do that. Get 200, and we'll see what happens.
Otherwise, off the page.
I'm stuck. Okay, what about now, though? Better? No? Off the page. All right. I'll make it. I don't know. And then we'll go with it. Well, there's not really any visuals. There's just slides. So, okay. So I'm here to just discuss and kind of follow up the last time TEPI met. They sent some recommendations forward to EMS Council regarding the use of the validation score for the PEEP data completeness standard. So for a while, we've been working on trying to find a way to measure in a timely manner, in an accurate manner, the data completeness for the Premier EMS Agency program. And so TEPI sent forward some recommendations to EMS Council, and those were a validation score of greater than or equal to 90, a median, and then also that there'd be quarterly agent score reports. So at a minimum quarterly, but we're probably I'm already sending something out monthly. And also that 1 year from the go live to bring the score up to greater than equal to a 90 medium. So the agencies would have that amount of time to get to that 90 medium. And when EMS Council met in January, they approved those 3 recommendations from TEPI, and then they added some additional stipulations that we kind of asked them to give us. So one was they indicated a go live date of March 1st of this month, so 2021. So that means, of course, that agencies will have 1 year, so till March 1st, 2022, to bring their score up to a median of greater than or equal to 90. And that this, at that time, the previous 1 month or an average of the last 3 months will be reviewed to see if they've met that 90, kind of giving them 2 different options in case they had just 1 bad month right before that date. And then we'll review it quarterly from then on. And there will be a 3-month grace period for changes of when an agency perhaps changes EPCR vendors, which happens occasionally, or when there's a version change. So occasionally there's a national shift in what version is accepted. And when an agency makes that transition, if it happens to be right around when the review of the score is, then we'll give them kind of a 3-month grace period to catch up and make any changes in training and things like that. So that is it. That's kind of where we're at. I don't know if anybody has any questions, but if not, that's all I've got.
All right, Anne, thank you very much. All right, item 5, discussions and action items. Everybody has attached 5A, the TEPI meeting minutes from November 19th, 2020. I would like to call for a motion to approve, amend those, please.
Rebecca makes a motion to approve.
I'm sorry, who was that?
Rebecca Haro.
Rebecca, thank you.
Second from Michelle Guandola.
Second for Michelle. Thank you, Michelle. I'll give everybody a few minutes to look those over. All right, any amendments needed on those meeting minutes? Is everybody okay with those? If not, I would like to have a vote. May I get the nays abstaining? Those who approve? Could I have a call for vote?
Aye.
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 Thank you. Could I have a call for vote to approve? Or is there a motion for that, please?
No, I think you got your vote.
Oh, okay. Thank you, Shelley.
Those are approved as they stand.
Okay, thank you. All right, item 5, standing item to discuss the sequence for discretionary reports. That's item B. That's attached. May I have a motion to discuss the list of discretionary reports, please?
This is Tiffany Struver. I move to approve the discussion.
Thank you, Tiffany. Second?
Allison seconds.
Thank you. Dr. Bradley, do you have anything to say on the discretionary reports?
Sure. So I know that this has kind of keeps getting passed along the road each TEPI meeting, but we wanted to kind of just bring this up. We have not forgotten about this. I think part of the issue is that we are, as kind of different things come up within data issues that are more pressing related to COVID, that's taken a little bit of priority. And so we've really done quite a bit of reports, or I should say Voxel and her team have. So I know we haven't really addressed any of these, but we did recognize that some big items from a public health perspective are really looking at kind of patient refusals in regards specifically to how COVID has affected that. We're seeing a lot more non-transports. I think patches for medical direction for refusals in the hospital setting as well. And so we want to try to compare how that looks when we look at high-risk entities such as chest pain, stroke, dizziness, things that could potentially have an improved outcome if they sought care in the emergency department sooner. So we are continuing to look at those items, and we'll produce those reports. And again, like I mentioned, they are doing a lot of work just kind of monitoring the out-of-hospital cardiac arrest data and opioid data as well. So I know we have not kind of gone down the list and tackled some of these projects, but just wanted to make sure that the TEPI committee understood we are definitely working on some other data-related items.
Okay, understood, Dr. Bradley. Thank you very much. All right, we'd like to have a vote to approve as they stand?
Approved.
Who is that, please?
Michelle Guatemala.
Thank you, Michelle. Second?
Paul DeBrow.
Second, James Cunningham.
Thank you very much. All right, on to item 6, updates from the Trauma Registry Users Group. First, I would like to say goodbye to Mary Binkert. She was a great resource, and we will miss her very much for her role. And with that being said, I would like to welcome Carissa to the team. I'm looking forward to working with her from a Trauma Registry Users Group perspective and from the state. As far as the registry goes, I know that we received, most of the hospitals should have already received all of their updates for the 2021 year. I would make a suggestion that everybody goes through their data dictionary book and compare each tab and each element to their trauma registry. And also, we are aware that the 2015 AIS has not been uploaded yet. I am working with Vatzel and some other members from the team to see what we will do moving forward with that. So we are working on that. Other than that, that's it from the registry perspective. Trauma Program Manager Workshop, Heather Miller.
Heather was not able to attend today. Is there anyone else on the meeting call from the Trauma Program Managers Group?
Yeah, this is Debbie for Cake. We haven't had a trauma management meeting in person. We had an hour meeting, and there's nothing really to report from that.
Thank you.
All right, thank you. EMS Registry Users Group, Raymond Proa.
Yeah, this is Raymond. No changes from the last meeting. I believe the next meeting is scheduled for April 19th of 2021, 10 to noon. So probably next meeting I'll have a report for you.
All right, thank you very much. Item number 7, agenda items to be considered for the next meeting. Is there anybody on the meeting that would like to have anything considered for the next agenda?
Hello, my name is Lydia Ilea. I'm just a public member. Is this possible to request something on the agenda for next meeting?
Yes, please. Go ahead.
There's current legislation going into the House regarding CPR and excessive calls in residential care. I am a member of the Arizona Assisted Living Homes Association, and unfortunately in residential care, we do not have much statistics to bring to our members to move forward. And we like to put it on the agenda to discuss with the EMS if there's any statistics that we can bring forward to our members and discuss, some of the concerns that were brought up in the public.
Okay, and I'm sorry, can you repeat your name again, please?
Yes, it's Ligia, Ligia, last name Ilea, Ilea.
Okay.
And
Shelley, is it?
so-
I'm sorry. Go ahead.
So this is Gail Bradley. Can you just more specifically outline what statistics you are asking, just so that we know if that's a data request we can provide or not?
Yeah, the concern of the public and many firefighters are saying that in residential care, caregivers are not performing CPR on cardiac arrest, and there's too many excessive lift assist calls. So they're trying to form some legislation to require caregivers to perform CPR and, to minimize the calls, the unnecessary calls, if we can say that. So we don't have any statistics in residential care. Some of the reports that I've looked over only show anything from skilled nursing or assisted living centers. But in residential care, we haven't seen statistics. But, this has been a big concern of many in the public, and we just don't have any information to bring to our members to address this issue.
Okay, thank you for clarifying that. We will have to look at the data set that we have and see if that's something we can provide. We'll certainly put that on the agenda for the next meeting, and we'll circle back before then to figure out if that's specific data that we have in our AZ Peers data set.
Okay, much appreciated.
Hey, Legia, this is Dave Harden with the Bureau of EMS. Have you been in contact with Steve Wagner from the Right Care Foundation?
Yes, actually, he's the one that proposed the legislation through one of the representatives, and unfortunately, we do not have any information from Steve Wagner.
Okay.
The EMS reports that I've reviewed for Scottsdale that that he has submitted, and EMS reports from what I've seen, unfortunately, I'm not that familiar. I can't find any statistics, and I'm not familiar if Phoenix works with NEMSIS to get more targeted data, but I have not been able to find any data regarding residential care. And I know that in some states, it's not that high data, but in Arizona, we have 1,800 care homes and then 2,000 group homes. And so we have, maybe 20, 30,000 older adults in Arizona that, are in residential care. Unfortunately, we don't have any statistics on that or can't find any.
Hi, this is Ann Bosbrink. I'm the EMS data manager for the AZ Peers system. So it's the registry for the EPCR data from EMS agencies.
Yes.
I don't know if you can chat in your email address or send it to myself or Shelly, but we do have a data request form, and that way you can fill out exactly kind of the information you're looking for, and we can give you more details on what we have available, like Dr. Bradley kind of mentioned, and what our limitations are as far as even what we collect, to see if this is going to be helpful for you, and also if it's really kind of what you're looking for.
Yeah, I think I did a data request last year with HB 2260, and we didn't get any information. Maybe
okay, yeah,
I didn't
send me your email address or put it in the chat, and then I'll send you that form. I don't know if you filled it out with our group or not, specifically for the EMS data, but as Dr. Bradley mentioned, we have some, we can go over then what we're allowed to give out and kind of what you're looking for to kind of try to see what's going to be useful for you. But we will review it. We always review and get back to the individuals who put in a request directly through we have a form on our website.
Yeah, absolutely. I do believe it was through your department. Maybe I just didn't word it correctly on what we were looking for. It's really hard to find residential care statistics.
Yeah, and I don't know if we can get to that level. That's one reason it would be great to kind of talk with you offline and have you fill out that form so we can discuss what kind of we can get at and what we, may have limited information on.
Absolutely, that would be great.
All right, very good. All right, item number 8, call to the public. Is there anything from the public meeting that they would like to add? All right, I would like to go over the upcoming events. We have free 4-hour virtual traffic incident management training courses. CEs are awarded for that. Dates with registrations are on the link, I believe. Also, April 20th to the 22nd is the 2021 National Rural EMS and Care Conference that will be virtual. June 15th through the 16th is the AZ Chair Annual Rural Health Conference that's up in Flagstaff. July 13th and 14th is the Statewide Child Abuse Prevention Center Conference that's virtual. Also, October 7th through the 8th is the Southwest Trauma and Acute Care Symposium that'll be virtual. You can always visit the Bureau's web pages for upcoming events. And the next meeting we have is July 15th, 2021 at 9 o'clock. And if nobody has anything else, I will call this meeting to adjourn. Time is 9:34.
Thanks, Melissa.
Thank you, Melissa.
Thank you, everybody. Thank you, Shelley. Thank you, Dr. Bradley.
Thank you all.